APA is in trouble. We've lost 15,000 members over the last decade. We're having trouble getting student members to join. PCSAS is now accredited by 37 of the 50 top clinical training programs, and most of them hold APA in disdain. If they're just waiting for PCSAS to be qualify for licensure in enough of the states, and they're then going to drop APA. If we lose our future generations through PCSAS, we're going to have nobody to join the organization in the future. This is a wholly self-inflicted wound. About 25 years ago, the Dirty Dozen engineered a hostile takeover of psychology that pushed us far too far in the direction of being a professional guild. First thing I would do is double down on clinical practice guidelines. There is no non-psychotic disorder for which psychotherapy is not more efficacious and longer lasting than medications, yet we've now are twice as likely to medicate patients with the non-psychotic disorders than we were 20 years ago. The National Health Service in England has invested 700 million pounds in training psychotherapists in the psychotherapies, and we could do the same in this country. The second thing I would do is make common cause with psychiatry. Both organizations now produce clinical practice guidelines. Ours are good, theirs are not. They basically trump medications. If we get them to work with us, we can force them to stick to the empirical literature and everybody will benefit. In order to do that, we'll have to renounce our push for prescription authority. Right now, we're in fewer than 4 states and fewer than 200 members have that kind of authority. It's a loser for psychology to do that. The third thing we ought to do is stop giving CE credits for pseudoscience offerings like energy field therapies. That's quackery, and we ought to have nothing to do with that. Fourth thing I would do is give the vote to graduate students in psychology. They want to be part of us. If we want them to be part of us, we need to join with them. The fifth thing I would do is give independent licensure status to master's level clinicians. Masters are being trained in other disciplines. Ours are better trained and would be a service to the public and a service to the profession if we were to recognize that. Thank you very much.